So just a brief overview. Most of you, I think, have been on these Chamber Live events before. Select few today, but this is being recorded and it will go out on our social media, it will go out on Shekinah's social media, it will be on our YouTube channel, and we know that a lot of our members do pick up on these events and listen to them in their own time as and when they can. So hello to all of those that will be watching this at a later stage. We'll shortly be hearing from John Hamblin, who's CEO at Shekinah Mission, which I'm sure all of you have heard of and probably had some connection with in the past. It'll be really interesting to hear from John about how they have been supporting their clients through the COVID pandemic, how they're continuing to support them, what's been going on and how they've been managing. I sort of follow you on social media and see a lot of what's been happening, but it'll be great to hear a bit more detail from John shortly. In the meantime, just to give you a little bit of an update, what's been going on at the Chamber. As you know, the Prime Minister will be giving an announcement very shortly about some new restrictions. We're all expecting them to be very much localised and so on. British Chambers of Commerce have actually sent out a press release just today, basically saying that they do agree that what the government will be doing is right. Most people, and certainly all the surveys around the country over the past couple of weeks, will be in support of some more, some stricter local restrictions and stronger guidelines on what we can and can't do with regards to the spread of coronavirus over the next few weeks. However, it's going to have a big impact on business, and it's not just the businesses within those local areas. All those businesses will have supply chain, and it will impact on others. So if some businesses are closed, it's necessarily going to impact on other businesses that not just in that local region, but could impact businesses in our region as well. So we'll wait to see how that turns out. BCC acknowledged that no fiscal support is going to be enough at this time. There'll never be sufficient to keep every business going as it should be in normal times. And whilst BCC are thanking the Chancellor for enhancing their package, they are sort of putting a caveat that, you know, there's still a lot more that needs to be done, and a lot of businesses are going to suffer further because of it, which obviously is going to have an impact on their employees. So we'll wait and see how that pans out. The other thing that we've been doing, or I've particularly been spending a lot of my time on over the last couple of weeks, is the Kickstart scheme, which is helping 16 to 24-year-olds get into work placements, at least for 6 months, but hopefully in as many cases as possible, we can progress those onto apprenticeships, full-time, permanent jobs. There's been a huge amount of interest. We've already logged 200 plus application placements. We've got, well, I've had another 15 or so come in this morning. So we're acting as a gateway. And if you're not able to offer at least 30 placements yourselves, then you have to go through a gateway organisation. The Chamber are acting as a gateway organisation. We're working with partners across the city of Plymouth and the whole of Devon, including the local authorities, to help put all those placements through. It's a long process and we're yet to find out all the details, and it's very much a try and see, and we'll find out more as we go on. But if you want any information, or if you know of anybody that's interested, either as a young person or as an employer in the Kickstart scheme, then do get in touch with me. And I think Olivia will put my email address on the chat. So do get in touch with me and we'll see what we can do to help you. So I think really, without further ado, we should hand over to our guest speaker today, John from Shekinah Mission. to tell us all about what's been happening and what is going to happen and how you're coping with our homeless community at the moment. John, thank you very much.
Yeah, thanks, Helen, and thanks for inviting me. Just to correct you on something you think I'm going to cover, which is what is going to happen.
Sorry, nobody knows what's going to happen, do they?
So yeah, I'll be a wealthy man if I knew that. So I guess when I was asked to talk, it was a bit about talking about homelessness, Shekinah's response to the kind of COVID crisis. So I think we need to recognise that homelessness is a really, really kind of complex subject and not one that we can cover in the next 15 minutes. But I'm going to touch on some interesting facts and figures that might prompt you to ask me some questions in about 15 minutes time. So I'm going to probably talk for about 15 minutes and then we'll kind of throw it open to some questions and debate if that's possible. I guess one thing I always do when I speak to people is just check out that people understand what I'm talking about when I talk about homelessness, because I think for many people, homelessness is a kind of broad banner word that we use. And I think for lots of people, when you say homelessness, they immediately think about rough sleepers, which is one element of homelessness. But I think we have to acknowledge that there's lots of other forms of homelessness that are happening in our county. So families in temporary accommodation. I'll come to some figures later which may surprise you. I hope I don't depress you too much during this kind of brief presentation, but they're not brilliant. There's another term that we use. We've got a terrible habit, like all sectors do, of developing this weird kind of language. So we use all these kind of weird acronyms sometimes. I'll try to avoid using them, but we do use terms like sofa surfers. So these are people that will be staying with friends, not having a kind of permanent accommodation address, and will be moving around. And I think we would all be quite surprised at the volume of people that are living that sofa surfer lifestyle. And I think one of the things that's happened in COVID is that many of these people that were sofa surfers stroke hidden homeless have suddenly emerged into the system because people have asked them to leave. So I think there's been a bit of an influx of people that we knew we were there, but I would argue that we probably didn't know the real numbers. But obviously Shekinah's main bread and butter work has been around kind of rough sleeping over the years. And for me, rough sleeping has always been the most visible but invisible form of homelessness. And I use that phrase because it's when we see a rough sleeper, they're very visible, but I think none of us really know how to react. And I think for many of us, there's an awkwardness, there's maybe a bit of an embarrassment. For some people, there may be a bit about just go and get a job and get yourself sorted out. So I think it is rough sleeping is when life has really, really gone wrong and the wheels of the bus have fallen off big time. We know nationally the biggest single cause for homelessness, generic homelessness, is eviction from private tenancy. And that's changed. So if I go back to 3 years ago, the biggest single cause was relationship breakdown. What we've seen recently with changes to kind of welfare, and certainly housing benefit, we are seeing a lot more people being evicted from private tenancies for a variety of reasons. And some of those evictions are legal, and I would argue that probably quite a lot of them are not illegal as well. So what we do know about the rough sleeping population is that they often have a lot of additional very complex needs. And people keep saying to me, we're all 2 pay packets away from the street or 1 pay packet away from the street. I don't necessarily agree with that, because I think probably for most of us, we have a family network around us or friends network. So if you or I weren't paid for 2 months, I would probably argue it's highly unlikely that I would see any of you sleeping on the streets. The people we're working with have multiple and complex needs. We know that a very, very large proportion of rough sleepers have mental health issues. And we also know that a large proportion of rough sleepers will drink alcohol or take substances. And many of us working in the sector would argue there's a big issue around self-medicating around that. And I can tell you, probably if I was sleeping on the streets of Exeter, Plymouth or Torquay, I would probably be consuming loads of drugs and loads of drink myself, just to kind of make it a bit more kind of palatable, I guess. So COVID came along for us, as you can imagine, back in the tail end of March. And there was a government initiative called Everybody In. So the government came up with a scheme where they wanted everybody off the streets and in, and gave all local authorities a very, very short window of opportunity to kind of get people in off the streets. And I would argue, for those of you who don't know, we kind of predominantly work across Plymouth and Torbay, whilst some of our services span into other parts of Devon and Cornwall. Our main areas of activity are those two areas. So I think in both those areas, we worked incredibly hard. And in Plymouth, within 6 days, we managed to get 26 rough sleepers off the street and into 2 properties. So in Plymouth, there's a group of organisations that work together to address the issue of homelessness, and it's called the Plymouth Alliance. And one of the organisations secured 2 student accommodations, 26 beds in total. And over a 6-day period, certainly at our drop-in centre, we worked quite hard about engaging with rough sleepers, giving them the message that we needed to get them off the streets and in. We did it. And I look back and I do think it was a remarkable piece of work. In one that is I guess, challenged my own thinking about why is it we could get 26 rough sleepers off the streets in 6 days when some of us have been trying to do that for 20 years. So I think, you know, there are lots of reasons why, but I would still argue that actually it worked, and back then we got those people off. And I think there's lots of assumptions that people that sleep on the streets want to sleep on the streets. I hear this all the time. People keep saying to me, yeah, but John, it's their lifestyle choice. That's what they want to do. I've been doing this for many years now, and I cannot think of many people that have said to me, John, I want to spend the next 30 years on the streets. What people will often talk about is not being offered the right accommodation. So many people we work with do not want to move into hostels. So sadly, the current system is that if you are rough sleeping, you will probably be offered a place in the hostel. We run the hostel in Torbay, and I think we do a great job there. But for many people, if you're living a very complex, chaotic lifestyle, would you really choose to go and live with 30 other people with equally complex lifestyles? Probably not. So what I hear often from people is they don't want to go into hostels. So their choice is hostel or street. So that's why I think many people will kind of end up staying on the street. So the COVID stuff, I think, had a huge impact. And I think, you know, look, I've got to say this, I think it's an absolute miracle for us that in both Plymouth and Torbay, as far as I'm aware, and there are some people on this call that know me, so if I quote this wrong, please jump up and down and tell me I'm wrong. We've had no cases of COVID amongst the people we support or staff. We've had suspected cases, but none. And I think, you know, that is remarkable, really. Bearing in mind that Shekinah staff and other staff, I see we've got Martha here from the Soup Run in Plymouth. You know, we have worked all the way through this, offering face-to-face support. So Shekinah took a decision about what projects it could keep open and what projects it needed to shut. And there were certainly some clear projects that couldn't continue. Some of our education and training activities that I'll talk about in a minute had to close. But certainly the hostel in Torbay, we cannot shut a hostel. There's 30 people living there. It's a 24/7 service. We can't suddenly decide to give up the ghost and shut the door. So we had no choice but to keep that service going, quite rightly so. Our drop-in centre in Plymouth, after we got those 26 people into accommodation, I transferred the staff who were working in the drop-in centre to go and then support people in those 2 houses. So there were 5 members of the drop-in centre staff went up to those houses, and as we speak are still there until the 1st of November, supporting those individuals who we got off the streets. So organisationally, we did end up furloughing a few people, but obviously the staff were very keen to kind of get back, which is what we've done. Now, in relation to what pressure COVID put on the system, so to give you some kind of indication of figures, so if you take somewhere like Torbay, during the peak of the COVID crisis, we had 250 people and families in temporary accommodation, and that today is still at 200, and that's up generally from about Torbay. Generally, we'll have somewhere around the 80 to 90 people in temporary accommodation at any one time. So there was a huge upsurge in people presenting as homeless, and that could be about sofa surfers who the people they were with didn't want them there, family breakdown, people. Certainly, we saw an influx of younger people being evicted, parental evictions, where parents felt their behaviour was such that they couldn't take the risk of keeping them. So we saw this massive surge of people presenting as homeless. So 250 at the peak, down to 200 in Plymouth. So I looked at the figures this morning. So in Plymouth, we still have 78 people and families in temporary accommodation. and we've got about 20, 25 on the street at the moment. And in Torbay, we've got about 15 people on the street today. So it's certainly, I think, increased demand on services. And one thing I would applaud both Plymouth and Torbay for is that they didn't choose to do what some other local authorities did, which was to take on lots of hotels. So you would have read the press, certainly places like Manchester and some of the other big cities kind of block book hotels for a period of time, which sounds good, but was going to run out at some point. Then what do you do with all these people? In Plymouth and Torbay, I think we've gone for taking units of accommodation, albeit maybe 12-bedded ex-student accommodation, or maybe smaller units of kind of 4 or 5. So I think, you know, all credit to both Plymouth and Torbay for that decision. Obviously, the government chucked a load of money at it because they recognised you can't do this for nothing. That money is slowly coming to an end. So again, I guess without sounding like a doom and gloom merchant, you know, my concern when I look forward is that we've got, I think, all the key ingredients for a perfect storm. So if we think about the economy, you will know this better than I do. If you think about the potential job losses that we're going to see, if you think about rising rough sleeper numbers that we're sat on at the moment, and I don't know whether you're all aware, but government, as part of the Everyone In process, banned evictions. So one thing they did was that they said to landlords, you cannot evict anybody for the next X amount of months. Now that's been extended through to October, but again, many of us are very concerned when that eviction ban is lifted, that we know that the process will start again, and there are lots of people on the point of eviction, and there'll be lots of people where the eviction process will start. So we are very concerned about the future in some respects, about that pressure that's just going to keep up, just because things may be coming back to some sense of normality, and I say that very loosely. I think the future is going to look incredibly difficult for lots of people at the moment. So just very quickly about some of the other stuff that Shekinah did. So I talked about our drop-in centre. So many of you, well, some of you came down, I think, in February and did a lunch for us at our drop-in centre in Plymouth. It's Plymouth's only open access centre for rough sleepers, but at the moment it's shut, and it will be shut until probably week commencing the 1st of November. So the staff have been transferred to work in the 2 houses. We are then going to remodel the service when it opens. So under the COVID guidelines, we will have to nearly operate it on an appointment basis. That might sound a bit bizarre, but we're working quite closely with the rough sleeper outreach team, so they will control the numbers coming in. Because Helen, certainly you were there. I don't know how many people were there on the day that you were cooking, but if I go back 6 months ago, we would often see maybe 40 or 50 or 60 people during the course of a day. Going forward, we can't do that. We can probably have a maximum of 10 people in at any one time. So we're going to have to kind of run, I think, an appointment basis where people will maybe come in for an hour or 2 hours, they'll leave, and then we'll have to bring the next kind of cohort of people in. But again, it's going to be very difficult. You know, I think the other thing to say is social distancing and all that stuff's kind of great. It's very difficult for us to do, you know, especially in places like drop-in centres and certainly in hostile environments. You know, you cannot maintain a kind of 2 metre distance from somebody, you know, especially if you're working with somebody who's incredibly distressed. You know, actually, I'm still a fan of giving somebody a hug. And, you know, it's very difficult for staff to stand back and watch distressed people and try and maintain a 2 metre distance. So, you know, that's the backdrop that our kind of staff are working under. So drop-in centre will kind of reopen. Yeah, as I say, first week in November. Our training centre in Plymouth, so some of you may or may not be aware, we run a training centre. So I think one of the important things for us organisationally, we said many years ago, drop-in centres are good, but socks and soup and showers don't change anything to people. They may give short-term relief, but if you really want to break the cycle of homelessness, you have to give people more. It is about employment opportunities for those people. It could be about volunteering, but a lot more support than what traditional things like drop-in centres have ever provided. So our training centre is really vital for us, and Andy Kebby, who's online with us today, runs one of the teams out of 24, which is a painting and decorating social enterprise. So one of the things that we realised many years ago is that money won't keep coming through the door, and we've got to try to generate our own income. So we set up a social enterprise, a painting and decorating team. So all of those people in there are people that formerly used either Shekinah services or been in the system. And we offer contracts, and we've done quite a lot of work for Plymouth City Council, lots of kind of odd contracts around the city. So again, a bit of a plug for Andy, really. If any of you are considering, anybody from Plymouth, that is considering any kind of painting and decorating requirements, please give Andy a shout, because we'd love to go, obviously put a price in for it, which should be good. So our hostel, so I come back to the hostel in Torbay, another one of our projects, 30 beds. COVID hit. We basically had 2 members of staff. It was quite remarkable. 2 members of staff volunteered to basically live in the hostel, and they lived in the hostel basically for about 2 months in total, and they oversaw the running of the hostel, and it was incredible. And during the early days, all the other staff were turning up and handing kind of carrot cake and all sorts of kind of weird and wonderful delights through the windows for everybody to keep them going. But the hostel, it's gone back to normal staffing at the moment. Again, we are preparing, I think, for a potential, I think, at some stage another kind of lockdowns. So for us, a difficult piece of work. We've got 30 people living there. We can't ignore them. We have lots of things in place around COVID isolation rooms that we've had to put in. But again, I think the staff there have worked incredibly difficult against a backdrop of unprecedented circumstances. So in Torbay, so people don't realise that Shekinah actually has more projects in Torbay than it does in Plymouth, even though Plymouth was our birthplace 27 years ago. And we've got a community centre called Endeavour House, which is in Union Street. And we provide quite a lot of opportunities and activities from that centre, but we work very closely with lots of other organisations. So we have a male suicide group that meets there on a weekly basis. We have a ladies group. We have the police kind of based with us as well. We have sexual health services. So it's a community hub, lots of co-located services. So again, sadly, Endeavour had to shut. It shut for about 2 or 3 months. That has now reopened again. Again, we put lots of kind of COVID mechanisms in place about limiting access, and again, to make sure people are trying to social distance in that building. But again, I think they do some invaluable work. And I think I don't have to tell any of us that for all of us, forget people that are homeless, all of us have felt stress and anxiety through this process. And actually what we've seen is a massive increase in the deterioration in people's mental health. I think when you start seeing the suicide figures as they come out over the coming months, I think you will see suicide rates, sadly, I think will have risen quite a lot. And I think they will probably continue to rise for the foreseeable future at the moment. So we know that there's lots of people out there under huge amounts of pressure and stress. And I guess for some of us, we've got things called families and friends that we can rely on and kind of talk some of that stuff through. For the people that we're working with, often they have nobody. So things like having a centre like Endeavour House is open, I think is really invaluable for us. So that is open again. We also have a project in Torbay called the Grow Project, which is on 2.5 acres, right opposite Ockham Farm. It's a horticultural project. It's predominantly outdoors. We've got big polytunnels and barns and everything else there. But again, I think for us, the one thing we've learned through the COVID crisis is that's a site that lends itself to offer quite a lot of what we would call COVID safe activities. So we know all the advice and guidance is that you're far better off being outside than you are inside. So again, Grow is reopened now. And again, it's a place for people to go and just be in some cases. So many of the people go in there will have issues around mental health or substance misuse, and they can engage in a lot of kind of land-based activities, not just growing, but we do green woodworking, we do hedge laying and all sorts of activities up there. But a beautiful site for just people to kind of go and get away from the kind of stresses and strains of everything. So for us, that's been a real priority to kind of get that one open. And lastly, on the Shekinah projects, I've mentioned Andy's painting and decorating. We have another project in Torbay called Housing First, where we have basically a team of 5 workers who are working in the community with people with very complex needs, supporting them to secure and maintain their tenancies. And again, they've worked all the way through. There's been no break for them. And they've been doing prescription runs for people and all sorts of kind of stuff. And again, I guess if I had a plea, Helen asked me to think about what I want from you, and I'll come on to that in a minute. Certainly, if you know of any friendly landlords in Plymouth and Torbay that are willing to kind of work with an organisation like Shekinah, we would really, really love to hear from you. So I guess the challenge is, and this comes to a bit about what do I want from you. I never shy away from it, and I'll keep saying it, cash is king. We're a charity, we need it. We have seen our income reduced, and certainly Andy is responsible for generating some of that income. We've had to cancel quite a few events this year. So things, many of the kind of our our big ball and a number of other big events that would have given us our income to maintain our service levels have had to be cancelled. And so again, we are saying, and I know that money is tight for everybody, so I say that with a heavy heart, really. But again, if you feel inclined to support financially, we'd love to have a conversation with you. Other ways I think are, well, I've referred to the kind of Andy bit. If you've got any kind of painting and decorating needs, it's a great way of supporting local charity. You know, you're paying for a service, and the service is carried out by people who've managed to escape that kind of cycle of homelessness. And any of the profits that we make in the social enterprise, people are paid to work there, so it's paid employment for people. But any profits that the social enterprise generates comes back into the charity and gets invested in things like our drop-in centre, for instance, in Plymouth. And again, I think we're always keen to speak to people about volunteering opportunities as well. And I think people often look at Shekinah and think, well, I don't really want to work in a drop-in centre, but we have quite a lot of opportunities for people. We've had people offering us IT support, marketing support, all sorts of things. So if you feel you've got a skill that you think somebody like Shekinah could benefit from, again, we would, I guess, love to hear from you. The final bit I'm going to come back to is housing. And people want homes. People don't want hostels. That's what they want. And what we know is nationally, we've got a massive issue around shortage of accommodation. We know at the moment, I looked at the figures this morning, as we speak, there are 1.6 million households on the waiting list for social housing in this country. 1.6 million. We would have to be building something like 90,000 units of social housing every year for the next 10 years just to play catch up. So what we know, we're quite realistic, that's not going to happen. So we are looking at the private sector. We have no choice. Now, Shekinah, in some cases, are willing to underwrite some of the kind of rents and leases. So one of the things that we found during that COVID crisis is that there are some landlords who are reluctant to rent to some of the people that we support. Sadly, there is this thing called Google. And when you give a landlord a name, they'll often put it on the Google bar, and then they'll see some interesting history sometimes, and they'll come back to us and say no. So we've had to change our stance. So what Shekinah have said is that we will take the lease on. So as a landlord, you will be leasing directly from hopefully a trustworthy charity, and then we will guarantee to put support in for the clients. So again, if there are people out there that have access to kind of accommodation, Shekinah historically has never had houses in Plymouth. We've got a couple of houses in Torbay, but it is our intention to change that. So one of our strategic changes organisationally is that we will be securing and providing some accommodation in houses in Plymouth over the next year or so. So I think I'm going to just pause there for a minute, and I guess just my final reflection around COVID. You know, look, it's been very difficult and it's been very sad, and we mustn't forget the fact that 40,000 people have lost their lives over a 6-month period. But one of the things I keep saying to people said to me on numerous occasions, John, you must be really glad when things get back to normal. And I'm kind of saying, no, I don't actually. I don't ever want things to go back to the way they were. What I've seen through the COVID crisis are incredible acts of kindness and generosity, and suddenly us getting to know our neighbours, caring for each other. I don't want to lose that. So if it's a choice of we're going to get rid of all that, John, and go back to the way it was back in February, the answer is no. I want to get rid of COVID, of course I do, but I absolutely want to hold on to that stuff that I've talked about, because we've seen some incredible acts of kindness that I wasn't observing before. And I think as a society, for all of us, I think we need to hold on to that. Anyway, I'll pause there and throw it over to any questions that anybody's got.
John, thank you so much for that. That's incredible insight into what you and your team have been doing. And I can only, and I'm sure that everybody else will join with me, commend you and your team for what you've achieved during this most difficult of times. I think I agree with you so much about what you finished off with saying, that the positives, and I think it's important we all have to take positives out of this wherever we can. And that is that in society generally, but obviously particularly in your experience with regards to Shekinah and the homeless community, you know, there has been quite an outpouring of kindness and caring that it's probably always been there, but it's not been so prominent. We've not seen it, and quite often in times of hardship, I suppose, without philosophizing too much, we do tend to get this from our communities. We've seen it everywhere. I've got several questions already. Is there anybody who would like to raise a hand and ask a question, either a virtual hand or just stick your hand up in the air? I can see you all on one screen, I think. Sean, yeah, unmute yourself. That's it. Great.
Yeah, I've got a question for you, John. The fact that we're all being forced and we've all accelerated our use of digital technologies, I would imagine that that would come at a bit of a challenge for some people who are rough sleeping or homeless. Are there certain ways in which the fact that we are now applying more online and we're communicating online, homeless people are finding that a bit of a challenge? And is there a way in which we can help to overcome that challenge?
I think it's a really good question, Sean, and certainly through our adult education program that we offered at Shekinah, one of the things that other providers was they switched to online learning. And as you say, many people who, or certainly if you're on the street, you won't have access to kind of digital technology. And pardon me, and even some of the people that we support who are in accommodation are living in real poverty. So having things like laptops and access to kind of internet or a decent internet has been hugely challenging. And I don't want to poo-poo it, because I think IT and technology has a real place, a real role to play. I think the one thing I have learned is how important human connection is for people. And again, I think for all of us, many of us get that human connection from when we go home at night with our families or our friends. Again, we're talking about a group of people who are very lonely, and we know that loneliness kills. All the evidence tells us what loneliness does to people. So what we've seen is when we started reopening up some of our projects and had conversations with people about, okay, so if we could get you laptops, would you consider doing kind of online stuff? Overwhelmingly, most people say no. We want to come and see you. We want to be able to look into your eyes. We want to be able to hear your voice. We want to be able to sense you. So I think it's got a role to play. And again, we're always keen to take things like laptops. If people having to clear out of any kind of computer equipment, please kind of give us a shout. So I think it has a role, but I think I can't play down the importance of that face-to-face contact with people that we're supporting.
I endorse that. I was, funny enough, speaking to a neighbour of mine yesterday who's a psychologist, and she's doing a lot of her consultancy work online at the moment, and she's hating it. She's finding that even as a psychologist, she's finding it a real stress not having that one-to-one contact with her clients. And so you can imagine that if you're on your own, lonely, homeless, and lots of other issues as well, that's all exacerbated. So yeah, whilst I can see exactly what you're saying with regards to technology, it makes a massive difference for all of us to be able to do our jobs in some way, but nothing takes the place of being able to speak to somebody, have that contact. I mean, I don't know about you, but we've started coming back into the office on a bit of a rota basis. It's great to come back and see the team. I can be very productive at home, but it's really good to have that contact with your colleagues and friends and so on, and we're very fortunate. So right, does that answer your question, Sean?
It does, but I just wanted to leave another thought to everybody else that's in the room at the moment, is that the directors of British Land, my employer, being Drake Circus, because I didn't introduce myself, as you put in the chat, so sorry about that. But my employer, British Land, the directors actually forwent their bonuses this year and put it into something called a community recovery fund. And the community recovery fund, and I have been in conversation with Andy, and we're just trying to get something past the post in relation to this. But if there are community groups who are struggling with the impact of COVID, and they've been challenged, or they've had to put off some of the projects or some of the initiatives that they were going to be working on, then British Land have got an application process which would come through myself to be able to release not a massive amount of money, but to be able to help our local community, because having a balanced and sustainable and healthy local community is really important to the shopping centre as well. Because we don't want people to be rust sleeping, we don't want people to be homeless, we don't want people with mental health issues. So if there are ways in which we as British Land and Drake Circus can support any of those businesses, then please let me know. I will put my contact details in the chat for everybody.
Yeah, please do that, Sean. That's brilliant. Thank you very much. Yeah, it's so important. I think every business, every organisation, every individual can find a way of helping, even if it's just in a small way. We can all support other parts of our communities. It's just finding the way that works for your organisation. And that is meaningful as well for for some places like Shekinah. So with regards to helping, John, I mean, I just think some of the national figures are absolutely astounding and the need is huge, but we all have contacts, we all have networks, so it's up to us to spread the word as well, and do as much or as little as we can. I'm sure it all helps. Zoe, you're on the line here. I've lost you. Are you still there, Zoe? Yes, there you are. I know that, I don't know about Shekinah, but I know that with your vegan boxes that you do stuff for charity as well, don't you? Are you happy to talk about that briefly now?
Of course. So I do the soup run most weeks, but I do donate my vegan recipe boxes as well. So for every 2 that are sold, I donate 1 through PATH. I think this week's donations are going to Trevi House. So yeah, and as it grows, because it's very new, but as it grows, more and more people are coming to me for that. So yeah, I mean, I'm willing to do anything to help at all.
Brilliant. And that's that kind of thing that just makes a difference as well, isn't it? You know,
I think my last lot of donations went to a house in Stonehouse where there were about 4 rough sleepers. And they got a box for a meal each, homemade baked beans on toast, and I got photographs of them actually preparing it, which is fantastic. So yeah, it's a really good thing to be doing. It makes me feel good anyway.
I was going to say, it gives a huge sense of satisfaction to yourself as well, doesn't it? It's not just those people that you're helping out, that those acts of kindness reflect on yourself as well, and I think that's something that we can all learn from. Has anybody else got any other questions before I go back to the ones that I've already been sent here?
Martha's got her hand up.
Martha, yes, please, Martha, sorry.
Hi.
Difficult question.
Thank you, John. Just I wanted to say thank you for what Shekinah has done during the pandemic and also throughout the years. And you've mentioned several times that you don't want things to go back to normal. And I was wondering what lessons have been learned from the services response during COVID that can inform future efforts.
So, really good questions, and can I just say for the rest of you, this comes from a lady who is been inspirational for me as well in relation to the work that she's done in the soup run. You know, Plymouth Soup Run and the team have again operated all the way through this process, and we work really closely to them. And the city, I think, should be very proud that we've got a soup run in the way that we do have in Plymouth. So yeah, well done. I think, well, you know, for me, there's something about questioning the role and purpose of something like a rough sleeper drop-in centre in the way that it used to run. I think we've learnt lots around this issue of trusting people. Certainly, I know at the hostel in Torbay, the way that we had to operate for the first 2 or 3 months in particular was that we had a skeleton staff there, which meant we had 2 members of staff move in and they basically lived in a kind of office upstairs, which technically meant the front door was open in that hostel. Now, if you'd said to me that a couple of years ago, what would happen, John, if we just left the front door open at the hostel in Torbay, I think I would have probably, along with everybody else, said there's going to be one massive party and we're going to have a problem on our hands. That was not the case, and I don't think we give people enough credit sometimes. Actually, the people that lived there actually really stepped up, and you know, it was their hostel. They didn't want any infections coming in. they were very self-managing. So I think Martha, there is something, isn't there, about that we just don't give people enough opportunity and credit sometimes. And we sadly read their history and kind of judge them before they walk through the door. And equally with scripts, without getting technical, what we know from drug treatment services that there were lots of people on daily pickups around methadone, and certainly that was quite difficult, I think, to continue in early days. So they had to switch from some of those daily pickups to weekly scripts. And again, you can imagine there were some people going, "Oh my God, this isn't going to work." Lots of deaths on the street. It didn't happen. So I think I would argue if your organisation has gone through this and you're not thinking differently, something's probably a bit wrong with you, or you've just missed the last 6 months, because I don't believe that anybody can come at this without thinking differently and actually understanding that there are different ways of doing things. And Martha, certainly for the people in those houses, so you know many of them like I do, 26 people who in some cases, many of those people have been on the street for years. Yeah. And actually it was joyous, I have to say, when I was going up to the houses to speak to one of those two people who were saying simple things to me. "John, this is just so good. I can get up when I want to get up. I can have a shower when I have it." All the stuff that you and I will take for granted, again, that was really, really reinforced for me during that process. So hence my bigger drive than ever now to say, actually, we need to end rough sleeping. We could do it. We proved it. We got everybody in. We don't want to go back. It's got to be about houses, but it just can't be about big houses, because lots of those people don't want to share with other people. So I think there's lessons splattered everywhere. And I think one thing that Shekinah's done quite well, along with the Alliance of Plymouth, is record some of that stuff, because my fear is that people will try to rewrite history. And we mustn't rewrite history. We must really, really learn the positive and the negatives that we've all gone through over the 6 months, because that will shape where we're going to go in the future.
Thank you.
Thank you. Thanks, that's great. Question I've had in the private chat, John, is why are the numbers in Torbay so high as opposed to Plymouth? Whereas you'd think Plymouth, being the bigger city, would have the bigger problem.
Several reasons, really. There's a lot more resource in Plymouth. So if you think about the charities that are in Plymouth, I could Harbour, Live Well Path, Live West, Hamos. I could in Torbay. There's Shekinah and a couple of others. So a lot less resource, a lot less funding. So I think it's no surprise, even in the local authority. The local authority's been absolutely decimated, I think, over the last 8 to 10 years. So if you think about the kind of monies that they were receiving 8 years ago, look at the money they've received, I think it's probably reduced by about 50% at least. And I think the other thing with Torbay, it's always had a bit of a reputation for people coming into Torbay for strange reasons. So often we'll see people there from all over the country turn up in Torbay. When we say why Torbay, it will often be things like, I remember coming here when I was a kid on a holiday. And what's interesting I didn't talk about was about the accommodation, especially something like Torbay. So we are even seeing the properties that are left and available in Torbay being heavily demanded. So I know that our private sector liaison worker was telling me that before COVID, we were looking at two or three properties for clients, along with maybe on average 2 other people. At the moment, when he's trying to bid on properties for our clients now, he's bidding against 25 other people. So there's lots of people wanting to move into Torbay. They want to live by the sea. They want to get away from the horror of COVID in the big city. So what we're seeing is demand is going up, which has pushed rent prices up as well, which is, I guess, a big concern. But Torbay, there's lots of people will joke about Torbay, saying it's a bit of a basket case and all this sort of stuff. There's some great people working in Torbay doing some really, really difficult work. And I come back to the fact that you can't keep removing money from local authorities and not expect things to fall over. And I think that's what we're seeing, but it's a big problem. 200 people still, or families in temporary accommodation.
Yeah, absolutely. I know it's known as one of the most deprived areas in the country, isn't it, Torbay? And yet, as you say, it seems to attract a huge amount of people. It's that, yeah, dilemma there, isn't it? Yeah. Thank you, John. I hope that question was answered sufficiently. There's a couple of questions regarding health issues. One is about testing, so COVID testing for homeless and staff, and do you have sufficient PPE and that kind of thing. And the other, which brings Steve Statham in, if I may, on that, is do the hospice get involved, and how do you deal with end of life for homeless people? So it's a two-part question. If I ask you to start, John, and then move over to Steve.
Yes, yes, we do have sufficient PPE equipment, but again, that's been an additional cost for Shekinah through this process. We've had to kind of fund quite a lot of that, and access to testing and stuff. So far, when we've requested it, we've kind of got it. So I know the whole kind of testing debate nationally is quite drawn out, but certainly in both Plymouth and Torbay, we've managed to get quick access to testing for both staff and for clients who our services. So yes, I hope that kind of answers the question. I'm not jumping up and down saying the world is perfect.
No.
I'm not equally jumping up and down saying that we've got loads of people who are awaiting tests and we've got no PPE.
No, but you were saying earlier that actually you've had no cases of COVID.
No, we've had some people tested, but we've had no confirmed cases yet.
That's great, because once you get that, then that's going to spread, isn't it, through the community?
Yeah, and before Steve speaks, just in relation to the hospice one, I think that's again something that's changed. I think over the last couple of years, that it isn't a conversation we've had with people about death and dying. It's a bit like the suicide conversation. Everybody wants to talk about it, but they don't ever want to ask an individual that question because they're worried what the answer will be. So certainly, I think as an organisation, we did quite a lot of work with St Luke's and stuff about end of life provision, because the reality, as you will know from what you maybe saw when you were down with us, that many of the people that we work with are chronic health conditions, and their life will be dramatically shortened, I think, in some cases. So I think having those questions, especially for people that are continuing drinkers or people that are continuing to take lots of substances, about their wishes around death and dying, I think is really, really important. Sadly, the other thing we have seen, without depressing you again, is that we've seen a bit of a rise in drug-related deaths, certainly in Plymouth over the last month. And that's about disruptions. There's unintended consequences to this sometimes, isn't there, COVID? So that clearly had a massive disruption to drug supply. So traditional drugs of heroin and stuff have been quite difficult to get hold of, and people have switched some use, and there were some bad batches that came into Plymouth. So we've certainly had a run of drug-related deaths, and I'm talking about people in their 20s in some cases that sadly died over the last month. But Steve, I think we'll probably add some stuff about the hospice.
Yeah, Steve, over to you.
Yeah, thanks, Ellen. Thanks, John. That was quite inspiring in terms of listening to your staff there and the way they've dealt with that through the COVID basis. And yeah, we tied up with John probably a couple of years ago because, as John said, they've got end of life needs as well, the homeless, and it was one hell of a learning curve for us as an organisation, but also I think for John's organisation as well, because what we were dealing with, some very, very complicated deaths as well, and some horrendous stories that it took us a while for my staff to get used to that as well, in terms of working with John and his team as well. And I think one of the learning curves we picked out of it as well, that, you know, John and his team, they really did know their people, you know, and it wasn't a case of us just going in and taking over and saying, this is how you do it. It was very much working in partnership with John's staff as well but it's all about education. It's all about trying to get them to talk about death and dying, and certainly about their own particular needs as well. So it's just really raising the conversation around death and dying with these people. But no, it's been a great experience for us working with John and his team as well. And I just hope that I'm sure, well, I know we have, between us all, we've made a difference to those people in terms of end of life. But as John said, you know, it was a real eye opener for our team to see the real complicated deaths these people are going through as well, and also the age profile as well. You know, because, you know, the majority of our patients were, you know, 70s or 80s. But also all of a sudden we're dealing with a lot younger patients as well. So it was quite a eye opener for our team, and but hopefully, as I said, we've got a good relationship with Shekinah now in terms of going forward. So yes, to help with those people, those end of life needs.
Yeah, I think for me and the organisation and other organisations in Plymouth as well, who were working with people that are homeless, the kind of work that St Luke's did with us all was just fantastic. So kind of, hats off equally to kind of Steve and his team. But I think Steve's touched on a really good point that actually, our work is difficult at the best of times. Then you start putting on top of it loads of people dying way before their time in very difficult, horrible circumstances. That again is just real added pressure for the staff, and something I think we're quite good at supporting each other. But it's not. Look, homelessness is not sexy, is it? If I was talking about a donkey sanctuary, it would be easy. But I'm talking about a subject that most people don't want to talk about, or some people have very fixed views about. It's their fault. And what I always say is everybody's got a story, and everybody we work with, it's somebody's mum, dad, brother, sister in many cases. All of us need to remember that.
Yeah, no, I think it's a hugely important lesson in collaboration that's so important, and it's very, very warming to hear that you're working so closely together. I think it sounds as if it's a great project, and I really commend you all for that. That's so important. And I think it's something that Zoe, again, has picked up in the chat. I don't know if you've had a chance to see it, but she's talking about her work with Real Ideas, and they're dealing with empty spaces as well. So I don't know whether you have any connections with Rio, or whether that's a conversation we need to take forward.
Yeah, we do, and again, I would say Plymouth is probably quite well advanced around the voluntary and community sector working together. And as and as much as it's really important, we have a really strong local in these towns and cities. I would also argue it's really important that we have a strong voluntary and community sector. And I think many charities are struggling at the moment, and I fear that we will lose some charities. I don't think everybody's going to make it, a bit like the businesses. I think we will probably end up losing. But I think it is important to, and I'm not knocking the big national charities, by the way, but I think it is important if you get the opportunity, not just Shekinah, you as a person that wants to give can give to who you want, but I would encourage you to support local charities, because it's those local charities that are making a real impact in your local communities where you can observe the change happening, which is really, really important.
Yeah, absolutely. 100% agree with that. And going back to Sean's point earlier as well, it's that impact on the whole economy and community of the city or of Torbay or anywhere else that's impacted by these issues. And as you say, it's so easy to shy away from them and pretend that they're none of your business. But actually, they're all of our business, and we need to be aware of it, even sometimes when it's not such a sexy thought, as you said before. I think really there's a couple of things. What I'd like to, we're almost time to finish now. So what I'd just like to tie up saying is, first of all, John and Andy, if you could just put something together for our newsletter and possibly into our profile magazine. Paul Burton's on the call, so he's putting together our profile magazine. But with regard to landlords and so on, and putting a call out to landlords, please put something in our weekly newsletter. We'd be happy to put that in and support you and get the word out. And I know Paul will put that on our social media as well and share that. And if there's anything specific as well that we can help you with, then is that okay, Paul? Give me the thumbs up. Yeah. But yes, we'd be more than happy to help you with that. And in the meantime, if there's anything else that you feel or we feel that we can help you with, then more specifically, then let us know. I would just like to go back to the fact, you've referred to it a couple of times, but not everybody would have known that back in early February, myself and the team, we spent a really fun day in the drop-in centre cooking lunch for the clients there. There were at least 60 people we cooked for, we served that day. It was fun, it was interesting, it was inspiring, it was humbling, and it was very, very enjoyable and surprisingly enjoyable. So once things are getting back to, I won't say normality, because obviously it's going to change, as you say, John, but if similar opportunities arise again, I would highly recommend that you and your teams get involved. and support in a practical way, even if you can't do it in a financial or like Zoe does, it's practical and it's giving way. But you know, there are so many ways that you can support, and by this way, the clients actually felt that they were human. They had that interaction with us. They felt as if they were respected as well, and that was, again, so very humbling for us. It was a really great experience.
Sorry, can I just add to that? That I think it's just so important that, you know, look, the people we support get fed up working with us half the time. You know, we're the kind of professionals that are going to kind of sort all this stuff out. We've screwed it up for the last 30 years. And I just think it's so important that volunteers come in and bring a fresh perspective. And as you said, Helen, it was fun. And, you know, our work is difficult as it is. Having fun is really, really important. And actually, people certainly in the drop-in centre sometimes just want to have a conversation about normal stuff with somebody that don't know them that well and don't really want to talk about their drinking or their drug use today. Just want to have a normal kind of conversation with them. And so that stuff is absolutely invaluable. We mustn't forget that.
Absolutely, John. Yeah. Well, I'm afraid we're out of time. That hour has gone so quickly, but I found it fascinating, John. Thank you very much.